Hello and welcome to Health Services 411, a program designed to keep you updated, informed, and educated about activities, events, and policies of the BVI Health Services Authority. I'm your host, Marketing and Communications Manager, Natasha Letzam. Hello, for today's 411, we're here in the dental clinic of the Peebles Hospital. We're here with one of our dentists, Dr. Sekou Pemberton. Welcome, Dr. Pemberton.
Morning, Emil. Thank you.
Now, we're here in your clinic, and he's about to give us a little tour and tell us a bit about the services that we have to offer in terms of dentistry. So you can give us a little tour, tell us about some of your services, and perhaps some of your staff.
So this is our front desk staff, and these ladies are the ones who would make your appointments and check you in when you come and you so forth. And they're very nice, very friendly, and they do a very good job keeping everything going smoothly for us, yeah?
Mm-hmm. And how do you make an appointment?
To make an appointment, you call 852-7660, and one of these two ladies will be happy to assist you. So we have currently 2 dental chairs, so 2 operatories where we would work simultaneously. Our operating hours are from 8:30 to 4:30 from Monday to Friday. As I said, you call for appointments, but we do see emergency walk-ins from between the hours of 8:30 and 9 every day. All right. We offer services for both adults and children. Cleanings, fillings, extractions, root canals, that type of stuff. So as I said, we do include everybody, adults, children, senior citizens, everybody, all right?
Okay. Nice, lovely. Talk a bit about, I know you have an event coming up, Give Kids a Smile Day on February 1st. Talk a bit about, the theme and, what are some of the objectives of that day?
Okay, well, that day is really to just raise awareness and to remind parents that they need to address the dental health of their kids, okay? Because a lot of times when children end up with toothaches, it's a lot of pain for them, they get infected, sometimes they require medication, that type of thing. So this is just something to remind people to just book general checkups every 6 months for the kids, starting at about 3 years old when they have all their baby teeth, straight until they're adults. And that's something that we should go from childhood straight into adulthood, getting a teeth check every 6 months. So but this day is focusing on the kids.
Okay, and what are some of the activities that you have scheduled?
Okay, well, we plan to actually do our school oral health program within the month of February. So we'll be visiting the primary schools, doing oral health talks within the schools and fluoride treatments, as we have done. We used to do that every year. After the hurricane, we kind of got derailed, so we plan on revamping and reinitiating it from this month of February.
And what is the importance of the fluoride treatment?
Well, the fluoride treatment essentially helps prevent cavities, right? So there's fluoride in your toothpaste and so forth. However, this fluoride is like a professionally applied thing that is done twice a year, and that helps add extra strength to the teeth, preventing cavities. It's part of your routine dental treatment, yeah?
And what are some of the key messages you hope to send as you seek to educate the children about oral hygiene?
Well, we essentially just proper oral hygiene, brushing your teeth, flossing your teeth, and that type of thing, as well as proper diet. Because when we find that a lot of the children eat too much sugary foods, snack foods, and that leads to a lot of tooth decay. So we're trying to educate both the kids and the parents as to the proper diet that they should have to help maintain a proper oral hygiene and good oral health, yeah?
Mm-hmm. And what is an example of this diet you're speaking about, and what are some of the take-home messages that you want parents to be aware of in terms of what types of food would be considered a good diet?
Okay, well, for a good diet, you're looking at a lot of fruit, vegetables, cheese, nuts, that type of thing. And the things to avoid would be sugary snacks, the Kool-Aids, the Capri Suns that have a lot of sugar, those types of things, the candies, those things we'd want to avoid as far as possible. But, the fruit, vegetables, milk, cheese, nuts, perfect diet for good oral health.
Okay. And your final thoughts?
As I said, just as we approach this Give Kids a Smile Day on Friday, February 1st, just a reminder to all parents, make sure to please keep the oral health of your kids in mind, book their appointments every 6 months so that we can keep them on a good routine treatment so that we don't end up with a lot of pain or any kind of problems for the kids.
Thank you very much.
You're welcome.
Hi, sweetie. Can you tell us your name, please?
My name is Jamar Smith.
Mr. Smith, what school do you attend?
I attend to Altus Gatliff Primary School.
Awesome. And what grade are you in?
I'm in grade 5.
Okay, so you're a big boy. Do you think that oral hygiene is important?
Yes, ma'am.
Why?
Because it helps you know if something's wrong with your teeth, and oral hygiene is best that you take care of it.
And what do you do to take care of your teeth?
I brush my teeth every day. I floss my teeth to make sure that there is no dirt in between my teeth.
Awesome. Thank you very much, Mr. Smith. So we're here with Nurse Valdrina Smith, who is a dental nurse. Nurse Smith, tell us a bit about what you're going to be doing today on Mr. Smith.
Well, Mr. Smith is here today for his usual checkup. So we're going to be checking his teeth, making sure everything is okay, and then depends on what we find, we'll clean his teeth and he'll be good for another 6 months.
Awesome. And we just spoke with Mr. Smith, and he is just a doll. You know, he's serious about taking care of his teeth. You can see his teeth look nice. But what advice do you have for other kids out there who maybe, you know, like a lot of candy, not paying that much attention to their teeth? Give us some advice for those children.
Well, all I can say is they need to come and visit us at least twice a year. And about the candy story, my policy about having the candy is to brush, brush, brush. Make sure you brush, especially in the evenings before you go to bed, and then the candy would make a difference.
So we're here with Croc the alligator. Hey, Croc. Hey, Tasha. Hey, Croc, you have some beautiful teeth. How did you get these beautiful teeth? Dr. Pemberton, talk a bit about oral hygiene in terms of how to properly brush your teeth.
Okay. Well, in order to do so, you take your toothbrush, you hold it at a 45-degree angle, just on the level of the gums, and you just do gentle circular motions. Right? That way, you clean the teeth, you clean just under the gums, so any food particles that get trapped in between are removed. Right? And as you just keep moving around like that. So you don't need to do it like this way, right? Because that way you can actually cause abrasions to the gum, you can cause bleeding and stuff like that. So that, which is what you don't want. So what you want to do is just to say that, just gently, good, a nice circular motion, all right? And you just keep going all the way around. And at the bottom you do the same thing, just 45 degrees to the gum, and you just move around. And then what you do as well, don't forget your tongue, stick your tongue out and just brush it straight up and down. Do not stick your toothbrush too far down your throat because it can cause problems, all right? And that's basically it, and that's how his teeth remain so nice. He brushes his teeth twice a day, and you should be brushing for at least 2 minutes at each time, so that, you know, 1 full minute on the top, 1 full minute at the bottom, and make sure not to skip any spaces.
Awesome. Now, one more thing with regards to the oral health and brushing. You know that, you know, in the news they talk a lot about the different classifications of toothpaste and, you know, which ones, you know, are better to use. What is the best type of toothpaste to brush with?
Well, for any fluoride toothpaste, to me, for children over the age of, say, 4, is fine. They have different flavors, different tastes, different ingredients and so forth, but having the fluoride delivery is the most important. So it's hard to really classify. Other than that, the only thing to watch about is that the toothpaste that are for whitening can actually cause sensitivity over time. So that's the only thing to be wary of. But in terms of what toothpaste is best, any fluoride toothpaste, any for children over 4 straight into adulthood. And for under 4, they have what we call training toothpaste or kids toothpaste that have no fluoride for the younger kids, so that they don't swallow the fluoride because it can cause their tummies to ache. So that's it.
And is there any benefit to brushing your teeth with baking soda?
Well, it can cause whitening, so it can actually lighten the appearance of your teeth, but it can lead to sensitivity as well. I do have to say that. But the baking soda can make your teeth look whiter in time, yes.
Okay. Well, thank you very much for the tour of the facility, showing us how to brush our teeth, and, you know, overall good oral hygiene. Thank you very much.
Thank you.
Reporting from our dental offices here at the BVI HSA, me and my co-host here, Croc the alligator. It's been a wonderful program, great bringing you this information on oral hygiene. And, you know, parents, please pay attention to some of the information that was shared today as we all try to give a kid a smile
a beautiful smile. Remember February 1st, Give a Killer Smile Day. Reporting for the BVI Health Services Authority, I am Marketing and Communications Manager, Natasha Letson. Thank you for tuning in.
Thank you for tuning in to this edition of Health Services 411. Please like and share this video and follow us at the pages below as we seek to improve the pulse of the people of the territory. Until next time, remember, your health is your wealth. Reporting for the BVI Health Services Authority, I am Marketing and Communications Manager, Natasha Letson.